How do you select FiO2 or fractional concentration of oxygen? The goal of selecting a specific FiO2 for a patient is to achieve a clinically acceptable PO2, which is around 60 to 100 millimeters of water, millimeters of mercury. Titrating FiO2 using pulse oximetry and ABG findings can minimize the risk of administering too much oxygen. Most of the time we start with 100% oxygen, then looking at the SpO2, if it is maintained about 90 to 94% or above, you can reduce the FiO2 by 10% or some cases 10 to 20% at a time and see for the trend. And once you stabilize, get a blood gas and see the value, how much you can come down to. The desired FiO2 is given by PaO2 desired into FiO2 non-factor, PaO2 non. That means if you take an FiO2 of 80%, you get a FiO2. You know the desired PO2, somewhere you can set between 70 or so. Then you will get the desired FiO2, assuming that the lung condition doesn't worsen during that time. Okay, so your idea is to reduce the FiO2 as much as possible, but definitely during your airway manipulation, disconnections, you make sure you give additional FiO2, especially when you are doing some procedures like endotracheal tube suctioning.